morning, everybody. Good morning. I'm Paul Hiltz. I'm the president and CEO of NCH Healthcare System here in Naples, and welcome to our community town hall. I'm pleased to be joined by the mayor of Naples, Mayor Teresa Hyden. Mayor, welcome.
Thank you. Thank you for having me.
Councilman Mike McCabe, thank you for joining. Councilman Mike McCabe is here, and then our Chief Nursing Officer, Mr. John Kling, is here, and we appreciate this opportunity to give you an update on a couple of things. Of course, the most notable and most interesting topic right now is COVID. We are seeing an uptick in cases. We're seeing an uptick in our inpatient COVID census, and we're going to get to those numbers and just as importantly to the vaccine questions and timing of the vaccine in just a minute, because we've got some experts here. But Mayor, I'd like to just start off by getting your reaction really to this community, your community, and the generosity, because we here at NCH have experienced, tremendous community support. And since the beginning of this pandemic, we've received over 40,000 donations of meals for our frontline workers, which just blows us all away. And we've received donations of PPE and money and cards and all kinds of support. And I just want to get your reaction to that, because it's just incredible to me.
Well, I think that this community is a community of giving. It always has been, and especially in a time when there's a crisis. And I'm so proud of our community for doing that. There are numerous people that have brought in food. They have made donations, and they continue to do so. My friend Bob Martin and his wife, they made masks, brought them in. And we all can do that. We can do a small part and continue to give to the community, especially in these times.
Well, it's made a big difference, and our team here at NCH is grateful to everyone in Naples. And I'm, again, really proud to say that through this entire pandemic, we've only had 2 of our employees infected by a COVID patient. We've only had 1 patient infected by another patient. So this community is helping to keep people safe, and we'll continue to do that. And we want to get the message out that it is safe to come to the hospital if you have an emergency need or an urgent need. It's safe to be here. We're open. We're doing elective surgeries. We're here to take care of this town, and we'll continue to do that. Yes, ma'am.
I just wanted to tell you, Councilman Blankenship, after our council meeting yesterday, was very thankful about the quality of care that he received. He did have to go into the ER, and I just want the community to know you have a quality healthcare system, and he was taken care of, and it was safe, and we're happy that he is healthy and back at council.
Well, I appreciate that, and it's a great segue to a little announcement we wanted to make today, is that we were informed yesterday from the Leapfrog Group, which is a national business group that rates hospitals across the United States. We're very pleased to let you know that we received an A grade, which is the highest we could get at the Naples North Hospital, and we received a B, very close to an A, for the downtown hospital. So incredible progress on our quality metrics. And that goes along with the upgrade from the 3-star to the 4-star CMS. And then we were also upgraded from a 2-star to a 3-star, which is the nation's highest rating for cardiac surgery. So a lot of great things going on, some good news to start. And so I'd like to just turn it over to you, Mayor, a couple of updates from the city and how you think our collaboration is going with regard to the information campaign around masks.
The All Heroes Wear Masks campaign and education and the distribution of masks has been appreciated throughout the whole community. We had the tree lighting on 3rd, reduced numbers. People were given masks from Naples Community Hospital. We also had the 5th Christmas lighting. I think there was 5,300 masks passed out. And I really believe that our community is being responsible. They care about the safety of this community, and the events have been pared down, and we see people wearing masks and not becoming complacent, which is that's where we want to stay with this community, and the message that we want the community to know that we said yes to masks, but no to a mandate. And I think that the community has been responsible, like I said, and are taking the proper precautions.
And Councilman McCabe, you brought an ad from today's Naples Daily News.
The campaign, and we spoke before we came on here, and thank you for allowing me to, because I came today to kind of watch, and then I was invited to sit in, so thank you. But, before the broadcast, we were talking about the things that really are noteworthy. And I think that one of the biggest things is how the community has come together, how people have kind of gone outside of themselves and looked at and seen need and addressed it, the donations of food, as you touched on, but even greater out in the community. I think that, the message underneath all of this is how the community cares, how people have gone outside and beyond themselves and looked at where and what they can do and really risen to the occasion. And I think what we've done from the city in cooperation with NCH on this All Heroes Wear Masks has taken this and really moved it into the community and made a great difference. And I really respect and thank you for all your efforts from NCH. I thank the mayor for really taking this on and moving it forward. So thank you.
Well, it is a community effort, and we received, some of the donations we've received were used to buy the freezers to store the vaccination, which
Excellent.
John's going to talk about. And to your point,
Yeah.
Councilman, as a country, we have to be thankful that this is the fastest we've ever brought a vaccination to market in our history. And John, you have some news about when we might be expecting to receive our first shipment.
So thank you, Paul. And I'd like to start out with thanking you, Mayor Hyman, for recognizing our staff. I wanted to also recognize you all before I get into my statistics and the great work you all are doing. It really has been, it says all heroes wear masks, but our frontline healthcare workers and our first responders are definitely the heroes. So I want to take an opportunity to say thank you and recognize you before we get into our statistics. And as Paul mentioned, we have today we have 81 COVID positive patients in between both of our healthcare systems. To put that in perspective, on September 28th, we had 10. At our height in July 14th, we had 144. So you've seen it's an 800% increase over our COVID census back in the end of September, but we're still about half of what we had at our peak. And I wanted to bring that to your attention because we do have capacity in our healthcare system. We're also talking before this broadcast about the national critical care bed capacity. We currently have 29 patients in our critical care units. We have 48 critical care beds. We can flex up higher than that, but we have 19 open critical care beds today. Of the 81 patients that we have in our hospital that are COVID positive, 10 of those are COVID positive. So the 81, 10 are in our ICUs. Of those 10 patients in our ICUs, 4 of those are on ventilators. So we're still seeing that trend away from the beginning of the pandemic where majority of our patients are on our med surg floors, not requiring ventilator therapy, but still requiring a lot of oxygen therapies and high flow stuff. So it's really continued to go down that road. Today, we actually started a newer updated visitation policy. And one of the things we had is to begin this pandemic, we took the early step back in March to stop visitation totally, start mandating masks back in March before it was actually the thing to do. And Paul mentioned some of our great statistics with patient and staff exposure. We wish it was 0, but I think that most organizations will be very happy to have the numbers that we have. So again, we take out of abundance of caution, we have changed our visitation rules, our hours, and it used to be 9 to 6, now we're 12 p.m. to 6 p.m. We're restricting it to 1 visitor versus 2. And we made that decision based on several factors. And it was what we set was some goals around the 14-day positivity rate in Collier County. Also, the total percentage of our inpatient census that was COVID. Because as we said in prior town halls and Zooms, that we have to create hospitals within hospitals to segregate COVID patients from non-COVID patients. We test every patient that comes into our healthcare system, every one of them, which has really helped us to not have any exposures. But by doing that, it's been challenging too. We had some lack of compliance from visitors, to be very transparent on wearing the mask. So in order to keep our patients and staff safe, we've really gone to a little bit of reduction in our hours in our med surg and critical care units. Our emergency departments and obstetrical areas, women and children's pavilion has a little different visitation hours. It's on our website at www.nchmd.org on our COVID site. So there's several documents that clearly identify what their restrictions are and the rules. And if you come to the hospital, it's safe to be here, but you just expect that we're going to ask you to wear your mask and follow the rules. So,
Hey, John, I know you're in contact with the Mayo Clinic infectious disease specialist up there, and you were able to explain to me that part of the protocol now that we're using turns patients on their stomachs several hours a day. And to your point, all heroes were wearing masks. It takes about 7 to 8 staff members for each one of these patients to get the patients prone like that. Can you update the folks here on any other updates from Mayo in terms of the drugs being used to treat the disease and how that's going?
So one of the things, thank you, Paul, for that. Yes, what that's called is proning. That's the medical term for it, and that's just turning the patient on their stomach and laying face down. It's very labor intensive, but it has shown that it's been very efficacious in keeping the patient off the ventilator. One of the things that I want to talk about today is also our monoclonal antibody therapy, which is the next tool in our toolkit for our COVID patients. And this is, if you remember the remdesivir, that's the inpatient IV infusion that COVID positive patients are on. And this became popular when President Trump had COVID-19 and had the Regeneron. That is a monoclonal antibody. So for almost a month now, NCH has had the Eli Lilly monoclonal antibody, and we also have Regeneron antibody. And that is an IV infusion that's in the outpatient setting. So any community affiliated physician with NCH or has privileges here can write orders. So if a patient is mild to moderate COVID symptoms and they're COVID positive, our outpatient infusion center here at the downtown Baker campus, we do about 6 to 10 infusions a day, and we're really showing some promising results. We've done 45 infusions so far, and we've had subjective really testimonials from patients who really felt better after their infusion while they were still in the outpatient infusion center. And then we've had several patients who we know that were in the ER that got discharged to get that and did not get admitted. So as we see the continual rise in our numbers, this is really a great thing that we've shared with our Collier County Medical Society partners. All of our medical staff here and I want our community to know that NCH does have a good supply of those monoclonal antibodies. So we have 190 of the Eli Lilly monoclonal antibody, and then we have 70 of the Regeneron monoclonal antibody. So we get allocation from the Department of Health and Human Services every week. So our goal is that we run out every week and use it all. So we want you all to know, and we're really working with our physician community and so to know that we have that available. So that's really a great thing for that.
And I do want to thank the mayor and the city too for teaming up with us just to advocate and lobby for these drugs being allocated to us as well as the vaccination, which we can talk about that too.
Yes. So we're frequently asked questions around our vaccine, and as most of you do know, but the governor and the state actually identified 5 hospitals in large metropolitan areas that got the vaccine yesterday. And that was in Miami-Dade County, Broward County, Hillsborough County, where Tampa, Orlando, and Jacksonville. As Paul mentioned, we have prepared it for the sub-zero freezer storage, and we have 2 of those, 1 on each campus. We've had them for about 3 months now, and we wanted to make sure we were ready. So we're not exactly sure yet, but we think we're going to be getting our allocation the week of Christmas. Hopefully we'll know more by Friday. But we want the community to know that we are prepared. We have had our administration process in place. We're just ready to pivot when we find out what the allocation will be, when it will come, etc. The one thing that we get asked a lot too is who's going to get it first, and NCH will strictly follow the guidelines for administration and the protocols and the phasing. So today what we know, just as I was saying before this started, that this changes almost daily. But what we know today is that the first round of vaccine administration will be for high-risk healthcare workers, and that would be in actual COVID-19 units or in critical care units that have their patients on ventilators. And the priority would be the employees at 55 and older, and then kind of stepping down throughout that. And then also, the first round also will focus on long-term care employees who take care of our residents in our skilled nursing facilities and long-term care facilities. And then there's like 2 to 3 more phases going down, with young children being the last phase. So, and the question we get a lot too is how much are we going to get? And we just don't know. The original Pfizer allocation was about 194,000. About 100,000 went to those 5 healthcare systems, and the other 94,000 went to long-term care facilities for those employees. So we've heard anywhere from 300,000 to 200,000. So there's really still a lot of unknown variables, but we have planned FAQ videos that we'll shoot as soon as we know, and post that on our website, share it on social media and on our website. So a lot of planned communication and strategies and operations about that.
So, and Mayor and Councilman McCabe, you'd probably be interested, as we track the data, at least of the patients that we're treating here at NCH, it appears that 2 things are becoming clear. One is that the length of stay is dropping for these patients. So we've learned some things about how to treat the patient. And the survival rate is actually higher than the national average here too. So hats off to the doctors and the critical care teams that have learning as we go, but doing a great job of taking care of people. And in the meantime, John, you and the mayor continue to just advocate for what we can do, right? Which is the mask, the hand washing, and the social distancing. So we'll continue to do that. Any updates on the convalescent plasma, and again, the response from our community to that?
Yeah, so again, thank you to all of you all in the community. We have a very healthy supply of convalescent plasma that we use along with the remdesivir and the Regeneron and the other Eli Lilly monoclonal antibody and the steroidal treatments and the proning. So if you think back on in March and April, when we had all those unknown variables and a lot of our patients were in the ICU across the country, it has really kind of almost done a 360 in how we're treating and doing this. And now with the vaccine coming out, it's that next step in this progression. So really, I think the entire scientific community that really worked around the clock to develop this new technology for this COVID vaccine really deserves our applause and gratitude. And we'll continue to do the right thing: social distance, hand hygiene, mask wearing when appropriate, and get through this and still have a safe holiday with our families and our friends.
So John, another thing that the communities, we've gotten a lot of questions is about the emergency department. They know we've had a lot of construction in the emergency department, but can you just update, first of all, when will that be completed and open? And is it safe to go to the emergency department in season with COVID?
Yes. So our first phase of 4 phases for our downtown Baker campus emergency expansion will be done. We're planning to open it up the week of January 11th of 2021. So very soon. We'll have the state inspectors here the week of Christmas the week after Christmas, to inspect it and sign off on it. And that also includes a new 24-bed observation unit on the 2nd floor, which gives us added capacity, private rooms, all private rooms in that department unit. And we designed those units with some negative pressure as well, based on the COVID-19 respiratory pandemic. So as we renovate and upgrade units, we think about the pandemic and or future viral or respiratory pandemics, and are from a facility standpoint. So yes, when you come into the ED, there are restrictions on visitation in the waiting room, but we do have compassionate visitation still, and always we will. And it is safe, and we have seen very, very good results, as Paul mentioned, with only 1 patient in the beginning that was exposed to this. So we're doing the right things, and we'll continue the right things, and don't ignore your healthcare issues. It's more risky to ignore that than COVID-19.
Yes. Mayor, or Councilman McCabe, any other comments? I know we'll have a few questions coming in. Anything we've missed or?
No, I think.
Well, I would say we would be, or I would be remiss by not saying we take this seriously. We take public safety seriously, And I know that there was some advertising this weekend about the beautiful unveiling of the Scorpion by Kathy Spalding. And if you weren't there, we all wore our mask, except for when we spoke. And then there was the unveiling of the Scorpion at Baker Park. And we lifted the veil. And we did it for a photo op, and that was the only time that we were without masks. So I just want you to know we are we're walking the walk and talking the talk. And it's important for the community to know that. And we know there's disappointment with our decision, but we do feel that we are getting the message out that masks are extremely important. And again, I just can't thank you enough for making sure that you've helped us in getting that word out to the community. And most people really are so appreciative. And for those that are disappointed in us, I apologize, but know that our community has been responsible. So I just thought
Well, thank you for that. It certainly has been and continues to be a community effort. And that's the only way we'll get through this. John?
And then speaking of community effort, I do want to recognize and thank our friends up north at Lee Health. They were in collaboration with us in the last week about the visitation changes to the policy. And we did mirror each other's practices when it comes to visitation. So we continue to share best practices and work collaboratively together with our friends up north and Lee Health. I think that's important to mention. And the last thing I'd like to mention before we get to our Q&A is I will be stepping down as the head of the COVID-19 task force here. I'll still be part of it, but hand that over to Ilya Echeverria. She's our Associate Chief Nursing Officer for Professional Practice and Operations. She's been on our team since day one. I'm doing that to free up some more time to work on other things that are initiatives in our healthcare system that are going to be key for us as we move forward on quality and patient experience and staff engagement. So thank you, Ilya, for stepping up, and know that I'll still be part of this. And it has always been a team effort, not any one individual.
Well, John, you've done a fantastic job, and you're not going anywhere. I mean, you're still here, but one of the things we do try to do at NCH is to develop our younger up and coming leaders. And this will be a great developmental opportunity for some new people on the team. You've got something big we'll be announcing over the next couple of weeks. But lots of good things going on here. And I think we can open it up to any questions that we have now.
So the first question we've received is aimed more towards the mayor. So Mayor Heitman, this person asks, are there plans to revisit the mask mandate at the city council?
Well, I don't want to get into any conversation that might jeopardize sunshine. So I'll just leave it at, we are supporting wearing masks, just no to the mandate at this time.
Next question is, are masks still available to the community through the All Heroes Wear Masks campaign?
Yes, they are.
Absolutely. I was just at Wynn's ringing the bell for the Salvation Army and handing out masks, and we will continue. Council members are still continuing to distribute them, and you can come up to City Hall, come up to the mayor's office, and get a box of masks. So yes, we have a supply still available for the community.
And another question is NCH mandating staff to get the vaccine?
So at this time, we're not mandating our staff to get the COVID-19 vaccine. We're strongly encouraging it. At this time, if they choose not to, we're still requiring the extra PPE, which is personal protective equipment policy, to be followed. But at this time, we're not mandating it.
So kind of related a little bit, John, you informed me of something I thought was interesting the other day with regard to masks and mandated vaccines and so forth. This time last year, I believe we had seen over 400 cases of influenza here. Is that about right?
That's correct.
And this year to date, we've seen how much flu? Two cases. So we've gone from 400 cases to 2 cases, which would make you think that masks might have some benefit, to the prevention of those kind of illnesses.
Yeah, and I would like to just clarify that those statistics are from October, November of 2020 versus October, November of 2019. and what we diagnose in our healthcare system. So that doesn't include outside of our four walls. But yes, you can see that there's been in our pediatric ER volume is down significantly, and we're seeing 0, I believe, that could be different from yesterday, but 0 pediatric flus, which is something that I think Dr. Patton and the Collier County Public Schools should be also recognized again for the work they're doing to protect our children in the community. And we're seeing much less presentation to our pediatric ER at North Naples campus.
You know, we always look for the silver linings in tough situations like this. One of the things that we've experienced here, and I think probably in many hospitals across America, is our overall infections in the hospital have declined because we've spent a lot more time thinking about them and cleaning, right, and disinfecting. And again, the community stepped up and bought 13 of these germ zapping robots that will stay in use even after coronavirus, just to kill MRSA and C. diff and other infections.
Yeah, I think really that's why we started thanking the staff, and I think we should end by thanking the staff when we're done with this call, and our community as well, to be able to increase quality patient experience through a worldwide pandemic that has this kind of effect on our mental health and well-being as well as physical. I think it's really yeoman's work, and really proud to work for you all. It's a testament to the quality healthcare that NCH, that Collier County has in NCH, and our new focus on collaborating with best practice partners across the country and in our region.
Other questions, Sean?
Last question is, when will healthcare providers not affiliated with hospitals be able to receive the vaccine?
So that's a good question. We're trying to work that algorithm. We had a call this morning with our Mayo Clinic partners up in Jacksonville. We're all kind of talking through the same thing. And once we know what the allocation will be, we'll be able to publicize that and put that out there. As Mayo Clinic as well, they're saying, we know when allocations increase, which they will, everybody will get that who wants it in the community and in our healthcare system. So this is going to be a journey, and mask usage will still be required until we see that the pandemic has slowed down and or stopped. And people often ask, well, when will we be able to stop wearing the mask? And that's going to be dependent on the percentage of our population that gets the vaccine, the percent of the COVID-19 increase or decrease. And then when herd immunity has been identified by our medical our teams, then we'll have some more information. But it's still going to be a while. So even if you get the vaccine, you're still going to be required to wear your mask, because we don't know if Paul, for example, got the vaccine. So until we see the change in the positivity rates in our country, is going to be with us for a while. So continue to do the right thing, and we appreciate that. We know it's tough, but it's the right thing to do.
And so, John, just once again, for people in the community, they have questions about visitation policies or anything related to COVID, they can still go to the website to get the latest updates.
Yeah, and our social media pages also have links to our COVID-19 web page at nchmd.org. There's a COVID-19 tab that has all of this on there. Our search plan is on there. Everything is on there, and we update that quite frequently with our team here.
And Mayor, I would think the same would be true for people interested in the city's, any policies, procedures related to this public health issues. Same thing?
Same thing. You can go to naplesgov.com, and there are updates on the coronavirus. There are updates on council and what we're addressing. And also, I really want to say, you mentioned the giving of your staff and the giving that Naples Community Hospital has done, and it's appropriate and right to make sure we have a safe community. And I just hope that the giving continues, but also that this is a season of hope, and that we all have hope while we continue to be diligent and not complacent about these rules, and have hope that 2021 will be a much better year for all of us.
That's our sincere wish, that's for sure. Are there any other questions, Sean?
That is it.
Well, with that, so I would thank John Kling, our Chief Nursing Officer, for your leadership. Councilman Mike McCabe, thank you for your leadership and willing to serve in elected office during a very difficult time. And Mayor Teresa Heitman, thank you again for the partnership, for joining us today. And we'll continue to stay in touch and keep updates on this this evolving thing, but as you said, you ended on a great note. So we'll hope for a very safe and healthy holiday and Christmas season, and look forward to being back with you in the new year. Thank you so much.
Thank you.